Hi everyone, welcome back to GAMT-LF. This is Dr. Karthik, and today we're going to discuss the management of local anesthetic toxicity. We're going to look at this guideline here, and by the end of the video you'll be able to recollect all this information in less than 30 seconds. And we're going to use GAMT, and if you're new to this technique, this is called the glyph assisted memory technique. It's a memory technique that is very helpful for high stake examinations, and we're going to do just that. So I created a GAMT for this, and let's jump into it. Okay, so this is the GAMT that I have for the management of local anesthetic toxicity. So this is a bunny with very stylish hair, all right, and a dancing girl bunny, okay, dancing in a poppy field, and it has a nice carrot next to it. Okay, so to say girl bunny because you see this stylish hair here, and then it has an anklet only on the one leg. You know, I think this leg is bent as well a little bit because obviously the bunny is dancing, right? Okay, and it's dancing in a poppy field. So this is the poppies in the poppy field, and this is the floor of the field, which is kind of a little bit uneven because it's poppy field. Okay, and you have a nice carrot here by the side. Right? Bunnies love carrots, I hope. Yeah? Okay. The beauty of this technique is that if you remember this GAMT, you can remember all the information relevant to the management of local anesthetic toxicity. All right. So in the GAMT, which is the glyph assisted memory technique, we use individual letters as glyphs and use them to build an image. And this is an image that's for the local anesthetic toxicity. If you have seen my previous videos, you will have seen other GAMTs for other topics as well. The biggest strength of this memory technique is that it can be applied to any field, especially for data-rich fields, and you can recall the information instantaneously. It also allows you to revise the information at a much easier level. Okay, so there you go. Girl bunny with stylish hair, wearing an anklet, dancing in a poppy field. That's all you need to know. You've just mastered the management of local anesthetic toxicity. Okay, let's see how. All right. So before we jump into the management of local anesthetic toxicity, we need to have an idea of what's the incidence of local anesthetic toxicity. The current incidence is somewhere between 1 to 2 per 1,000 peripheral nerve blocks performed. Okay. The ultrasound has greatly reduced the incidence of local anesthetic toxicity, but it still does happen. If you haven't seen my video on GAMT for common risks associated with anesthesia, you can have a look at that in the link given above. The incidence of 1 to 2 in 1,000 is similar to minor nerve injury, which has an incidence of 1 in 100 to 1 in 1,000. Obviously 1 to 2 per 1,000 is from the published literature and is probably largely underreported. So it's probably around this category. As you can see, this memory technique not only allows you to recall and remember the information much easier, but also allows you to compare and contrast with other topics very easily, right? So we were just talking about the girl bunny with an anklet for local anesthetic toxicity, and now you're looking at the laryngoscope GAMT for the common events and risk, and it's so easy to associate between the two. Okay, let's go through the GAMT. So this ear of the bunny resembles the letter C, stands for CNS symptoms. This ear resembles another C, which stands for cardiovascular symptoms. Okay, you see neurological symptoms of perioral numbness, agitation, convulsions, coma, and also metallic taste in the mouth, etc. So typically, the neurological symptoms precedes the cardiovascular symptoms. The cardiovascular symptoms include hypertension, bradycardia, heart block, asystole, ventricular arrhythmias. So it's important to understand that these are the two predominant symptoms that happen in patients with local anesthetic toxicity. Neurological symptoms usually preceding the cardiovascular symptoms. In some patients, you can just only have cardiovascular symptoms without any neurological symptoms, and that is possible as well. When you look at the data published on the symptoms of local anesthetic toxicity, around 1/3 of the patients reported predominantly neurological symptoms, and 1/3 reported predominantly cardiovascular symptoms, and 1/3 a combination of both. Okay, so you're doing a nerve block or injecting the local anesthetic, and the patient starts seizing. So what do? The initial steps are very straightforward. So the stylish hair of the bunny resembles yes, this resembles yes, stands for S for stop injection. The other side of the hair resembles another S, which stands for short for help. So stop injection, short for help, first two things you need to do. And then, as with any other emergencies, you need to follow the A, head of the bunny, resembles letter A, and the eyes of the bunny resembles letter B, and the smiley face resembles letter C. The airway breathing circulation forms the initial management of local anesthetic toxicity. And the nose of the bunny, it's kind of heart shaped, resembles the letter M, which stands for midazolam. So that is the drug of choice, or benzodiazepine generally is the drug of choice for seizures in patients who have local anesthetic toxicity. Low dose propofol and thiopentone can also be used, but because of the hemodynamic instability that comes along with it, it's better to avoid them. So once the initial management is done, we then go to the next management, which is the intralipid. So this is a hand, resembles letter I, this resembles L, which stands for intralipid. 20% intralipid, which is the mainstay in the treatment of local anesthetic toxicity. What's the dose of intralipid that you use? So this leg, this stands for the number 1, and the 5 fingers for number 5. That's 1.5 ml per kg bolus. That's the initial bolus you give. So in a 70 kg individual, that comes roughly around 100 ml. So you give a 100 ml bolus of intralipid. That's the first step after you stabilize the airway breathing circulation and give midazolam if necessary. And then you also start an infusion. So what's the dose of infusion? It is 0.25 ml per kg per minute. So this leg is bent as we saw earlier. The bunny is dancing. So that stands for, this is 2 strokes, that stands for 2. And the fingers, you have 5 fingers, that stands for 5. So that's 0.25 ml per kg per minute. So in a 70 kg individual, that comes to 17.5 ml per minute, which is approximately equal to 1000 ml per hour. That's the rate of infusion that you would start with. Okay. You see the anklet here. This part of the anklet resembles letter B, stands for bolus, repeat bolus. And this part of the anklet resembles letter D, which stands for double infusions. So if the patient is not responding in the initial 5 minutes after giving the bolus and starting the infusion, you can give another bolus. You can repeat another bolus as well. And you can also double the infusion from 0.25 ml per kg per minute to 0.5 ml per kg per minute. The maximum dose that you can give is 12 ml per kg. So this is 2 strokes, and this is 1. That stands for 12. So 12 ml per kg is the maximum amount of intralipid that you can give a patient. So in a 70 kg individuals, that comes around 840 ml. That's the total dose you can give in 30 minutes to 1 hour in patients with local anesthetic toxicity. Doses higher than that are not recommended due to the risk of complications. Okay, so you're doing a block. Patients have seizures. You stop the injection. You shout for help. You make sure airway breathing circulation are okay. Then you give intralipid. You give a bolus of 100 ml and then 1.5 ml per kg, and then you start an infusion of 0.25 ml per kg per hour, the other leg of the bunny. And after 5 minutes, the patient is still having arrhythmias, still very hypertensive, so you repeat the bolus. And the patient's blood pressure starts to return to normal and the seizure stops. It looks like the patient's symptoms are under control. And you have the infusion running. So how long do you keep the infusion running for? That's the next question, right? This design in the tummy of the bunny, which is probably resembles the shades, resembles letter T, stands for 10. So infusion can be stopped after 10 to 15 minutes of intensivity. So if the patient is stable, 10 to 15 minutes after that, you can stop the infusion. You started the bolus, you started the infusion, the symptoms are under control. After 10 to 15 minutes, you say, okay, let's stop the infusion. Okay, so what do you do then? How long do you observe the patient for? If the patient is just only minor neurological symptoms and responds promptly to the intralipid, 30 to 40 minutes observation is sufficient, and you can actually proceed with surgery if there is no hemodynamic compromise. Now, if the patient has hemodynamic instability, you ideally has to observe them for at least 6 hours. This is to make sure that there is no recurrence of local anesthetic toxicity symptoms. The floor here, as we saw earlier, is a bit wavy. It stands for letter S, stands for 6. So you need to observe the patient for 6 hours. So what are the complications that I was talking to you about before? This poppy, resembles letter P, which stands for pancreatitis, which is the complication that you need to look out for. The patient had intralipid. The serum amylase levels are important for the post-op follow-up. Obviously, this needs to be reported to the reporting agency. Okay. When you're coming on to the management of the hemodynamic instability, low dose adrenaline is preferred. So this stands for L and this stands for A. A lot of A's combined together. So low dose adrenaline. So it's important that the adrenaline dose is around 1 microgram per kg as opposed to the 1 milligram that you use for cardiac arrest dose. This is because high dose adrenaline has been shown to cause ventricular arrhythmias, increase pulmonary vascular resistance, and also increase plasma lactate levels, which can interfere with the lipid emulsion activity. Okay, so it's important to understand patients whom you're treating the hemodynamic imbalance with local anesthetic toxicity, low dose adrenaline is sufficient. Again, if you remember from the GAMT on perioperative anaphylaxis, you also saw that the dose of adrenaline will be 1 microgram per kg. Again, high dose of adrenaline is not recommended for perioperative anaphylaxis as well. Next, this stands for 0 or no, and this stands for vasopressin. So vasopressin is contraindicated in patients with local anesthetic toxicity. This again is because it severely increases systemic vascular resistance, which can actually reduce the cardiac output and further worsen the outcome in patients with local anesthetic toxicity. In animal studies where vasopressin was used to resuscitate the animals with local anesthetic toxicity, have shown to have worse outcomes than the animals who didn't receive vasopressin. So it's better to avoid the vasopressin in patients with local anesthetic toxicity. So let's go through the GAMT for local anesthetic toxicity, and you can see how easy it is to recall all the information. Okay, so you have the CNS symptoms, CVS symptoms, stop the injection, shout for help, A, B, C, dazolam. You have intralipid 1.5 ml per kg, 0.25. Repeat the bolus and double the infusion rate. This is for D. The maximum dose is 12 ml per kg. I need to continue infusion for 10 to 15 minutes after attaining stability. P for pancreatitis is the complication to look out for. Post intralipid infusion, you need to report this to the authorities. This stands for the observation period, which is 6 hours. It can be 30 minutes if there is minor neurological symptoms. Low dose adrenaline is preferred. Low dose adrenaline is preferred. No vasopressin in patients with local anesthetic toxicity. There you go, everything done. So this is a great tool for exam going candidates and also practicing anesthesiologists to remember this information on the go. So it allows you to have a very prompt and very quick response. So if you want to know how to create GAMT for yourself, you can look at the video here where I've described in detail how to create a GAMT. There's also a GAMT learning framework on how to apply the principles of deep learning into your everyday learning effortlessly using GAMT. You can see the description for that here as well. And also there is a GAMT recall strategy. The biggest benefit of GAMT technique is that it allows you to recall very easily. There is a recall strategy that goes with it. So any effective technique that allows you to retain information for a longer period has to have a recall strategy built in. There's a playlist on that as well. So please do have a look. Hope you benefit from this technique. I used it for the last 2 decades and I really benefited from it. I hope you guys enjoy this as well. Please don't forget to subscribe, like the video. Please leave your comments if you're preparing for exams and you find some topic very difficult and if you need a GAMT to remember the topics, just put it in the comments and I'll definitely have a look. All the best with your exams and all the best with your preparation. I'll see you in the next video.
Coding in your brain now, that's unique. Hook up the visuals, throw it to your mind. Associations flow, leaving old methods behind. Hard to remember, it's a drawing effect. With GAMT, you're smarter, so earn your respect. And check. Learn a GAMT that feel the beat. In every learning zone, you'll reach the feed. From glitch to riches, you ditch the glitches. Keep it under learning and you flip the switches. Learn a GAMT that feel the beat. In every learning zone, you'll reach the feed. From glitch to riches, you ditch the glitches. Keep it under learning and you flip the switches.